In this segment, we're going to watch Allison walking without poles, and then I hope to show you how her alignment improves when she uses the poles. So without, arms down, free. And what I'm trying to have you see is how Allison tends to walk with her shoulders behind her pelvis, when ideally they should be over the pelvis. When I teach a patient how to use poles, I start out by just having them, get them in good alignment for starters, dragging the poles behind their bodies, just leaving the arms limp, and then trying to just keep dragging but adding the arm swing. And as you can see, it's not grabbing on because I don't have any weight on it. And eventually working till you have a bit of a slight pole plant. And it's like walking with a cane, alternating from side to side. When I first saw Allison walking, you're walking better now. She was really walking with what's called a Trendelenburg gait, leaning side to side because her hips were so weak, but there's obviously been an increase in her strength with the exercises she's been working on, which has included walking with the poles daily. So let's see Allison walking with the poles now. Here you go. All right. So what the poles help her do is engage her core a little bit so she can keep her ribs over her pelvis. It unweights the legs a little bit, so she's not going to be getting having the weight bearing and the challenge of walking without the poles. So go ahead and let's see. And you can see now how her rib cage is over her pelvis. And she showed a talent for doing this right from the start. It didn't require much training. It's sometimes a little more challenging. And it can be dangerous if a person is unstable walking. So you may want to take that yoga belt or just a regular leather belt if you're helping someone walk, and hold them. Let me just walk behind you. Just hold them at the waistband. I'm not really doing, this is called contact guard assistance. I'm really just holding on to her to steady her if she does happen to lose her balance. Ta-da!